Good afternoon and welcome, ladies and gentlemen. This is the House Health Subcommittee. It is Tuesday, March 26th, the year 2024. Ms. Adams, could you please call the roll?
Representative Hicks. Jernigan. Leatherwood. Martin. Mitchell. Sherrill. Terry. Williams. Chairman Hawk.
I am here.
You have
Thank you. The chair detects a quorum. Any members with personal orders before we get started today? I do have a personal order. We have our doctor of the day. Forgive me for not being able to meet with you today, but Dr. Ellie Riley is here. Dr. Riley, if you could please stand up, we'll recognize you from Madison County, family medicine specialist. Thank you. Thank you so much for being here. Ladies and gentlemen, we do have a calendar before us today, and the desire is to work through as much of the calendar as possible. We do have a room at 1 p.m. tomorrow on Wednesday, March 27th. Should we need to roll any bills to the hill or have any remaining bills, we do have a room available tomorrow, once again, Wednesday, March 27th, starting at 1 p.m. I believe it'll be hearing room 2 is the location if we do not get through. Seeing no other further announcements to come before the group, we do have a calendar before us. We'll start right off on item number 1 on our calendar. Item number 1 is House Bill 282 by Representative Chairman Baum. You have a motion? You have a second. You're recognized, sir.
Thank you, Chairman Hawk, and I think I have an amendment.
That's right. We do have. Give me the number. I think the latest amendment before us is 17275. Is that accurate?
That's correct. That's what I've got.
Okay. Let me double check one thing. We've taken no action on any other amendments. So, ladies and gentlemen, let's go ahead and get the mandatory language before us so we can discuss in full. All those in favor of placing or adopting House Amendment Drafting Code 017275, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill is amended and ready for discussion.
Thank you, Chairman Hawk. Members, this is a bill that would increase access to health care and would provide health care to our constituents at lower cost. All this at no cost, no additional cost to the state of Tennessee. And it would do this by allowing pharmacists to issue and dispense with medications in 8 additional areas. And I want to add that these 8 additional areas have been discussed and agreed upon by the Tennessee Medical Association and the Tennessee Pharmacy Association. And these 8 areas are, let me list them for you. Number 1 would be in the area of antivirals for influenza and COVID. This could involve medicines for the flu like Tamiflu or Relenza. Area number 2 would be immunizations. Area number 3 would be treatments or preventative treatments for HIV. Sometimes they're referred to as PEP. If they're taken within a certain period of time, they can prevent the infection of HIV. Area number 4, certain hormonal contraceptives. Area number 5 would be epinephrine pens. Area number 6 would be naloxone. This is an antagonist for opioid overdose. Item number 7 would be topical fluoride agents. And item number 8 would be TB and TB skin tests. In some of these areas, pharmacists are currently permitted to issue and dispense with medications, but that's provided by Tennessee legislation passed during the COVID era that is set to sunset at the end of 2024. So this offers us with the opportunity to provide several things for our constituents. Again, the ability to increase access to health care. This is because about 90% of all Tennesseans live within 5 miles of a pharmacy. Pharmacies are on many street corners. It would allow, and some of these constituents do not necessarily have access to physicians. It would allow shorter wait times Many of these pharmacists would allow our constituents to walk in and receive treatment. You certainly wouldn't need a 2 or 3 week appointment. And it would potentially lower the cost of healthcare because many of these pharmacies are able to provide, would be able to provide some of these tests and treatments in some of the areas that I've just mentioned at very low cost. And so it would potentially save patients and the healthcare system some money.
Thank you, Chairman Boyd. You're up against the clock on your initial
Okay.
comments. Any questions or comments? Chairman, Dr. Terry, you're recognized.
Thank you, and I appreciate the sponsor explanation of this. I do have a question on epinephrine, and it says for patients with a documented history of allergies or anaphylactic reactions, would this be essentially a new? I mean, would this be like considered a refill, or would this be like a new diagnosis? How would you know the documented history? Would they have to get that from the practitioner, the family practitioner, or their doctor, and they've maybe filled an auto injector before, and then they're coming back for a new one? Is that what the intent
Chairman
is?
Baum, you
Like,
recognize.
I'm hearing people looking at that's the intent.
Oh, okay. And I can probably add that there could be instances where someone has a history of allergic reactions and they've had an epinephrine pen, but maybe that has been used or it's expired and they're not able to get to their physician for 3 or 4 days to get a new prescription to refill it. Under this bill, this would allow someone under those conditions to get a new epinephrine pen subscribed and dispensed to them so that they wouldn't have to go 3 or 4 days without one, waiting on the appointment with their primary care physician.
Recognize Dr. Terry.
Right, so it's not the intent of this legislation for just somebody to go into a pharmacy and say, "Hey, I need an epi auto injector." They have some history.
You would need to have documented history that of allergic reactions and having needed these pens. But that aside, I don't know who would want an epinephrine pen without that, but you would need that kind of a history.
Okay, thank you.
Thank you. Any further questions or comments? Ready to vote? All those in favor of sending House Bill 282 to full Health Committee as amended, please signify by saying aye. Any opposed, please say no. If you'd like to vote no, please let Ms. Adams know of your no vote. Your bill passes with affirmative action.
Thank you.
Thank you. Chairman Baum, we also have for you item number 2 is House Bill 2866. You have a motion, you have a second. Chairman Baum, what are your intentions with House Bill 2866?
Chairman Hawk, I do have an amendment on this as well. It's 017331.
Okay. Ladies and gentlemen, if you'll notice on our bar calendar on the amendment pack, that is the last amendment that was filed. Let's go ahead and adopt or look toward adopting. We have a motion on drafting code amendment 017331. All those in favor of placing this amendment on the bill, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill is amended for discussion. You're recognized, sir.
Thank you, Chairman Hawk. This is a bill that would set up a 3-year pilot program designed to get more nurses in practice in regional mental health institutes. The state has 4. This would be a way to increase the supply of nurses in these areas. It would do so by offering either scholarships or loan forgiveness for MTSU students. It would allow up to 5 students to receive a $3,000 per year scholarship award, or it would allow $25,000 in loan forgiveness for up to 15 students. In order to be a recipient of these benefits, you would have to either be working toward or possess the requirements to be a licensed clinical nurse specialist in a psychiatric or mental health area. In order to get the loan forgiveness, you would need to have a master's degree with the appropriate certifications. And another condition in this pilot program is you would need to practice in the regional mental health institute or institution for 2 years. If you don't do that, then you would have to pay back the benefits that you've received.
All right, thank you. And I am looking at the fiscal note of the latest amendment there. first year, second year, third year of the program, there are some although we're looking at policy here, just be aware that there may be some fiscal impact as the bill moves forward.
Yes.
Okay. Any questions as we've heard the explanation of the bill as amended? Seeing none, are you ready to vote? All those in favor of sending House Bill 2866 as amended to full Health Committee, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you all.
Thank you. We're now on item number 3 on our calendars. Item number 3 is House Bill 2376 by Representative Butler. Representative Butler, you have your motion, you have your second. You are recognized. And much like the other bills, I think that we've got some amendatory language that will actually make your bill.
Yes, that is correct, Chairman. It's amendment number 15674.
That is the amendment that I have as well. Let's go ahead and place the amendment on the bill. Committee, we are looking to adopt House Amendment number 1, drafting code 674. One more time, 674. All those in favor of placing this amendment on the bill, please signify by saying aye. Aye. Any noes, please say no. The ayes have it. Your bill is amended. For explanation, you're recognized, sir.
Thank you, Chairman. This legislation seeks to correct an oversight in our TCE code for home health organizations, and it is simply removing a loophole when it comes to licensing an issue. And so without going through a bunch of TCA code, it's a pretty simple bill, and I'll be glad to answer any questions or renew my motion.
All right. You've heard that, and you and I, we have spoken about this bill for several weeks now, and we've looked to find the caption on this particular piece of legislation that's dealing with a specific instance across the state of Tennessee. You recognize, sir.
And I do want to make sure I thank you for helping me with that, and Chairman Terry, both of y'all's work, especially yours, Chairman, in finding us a caption to address this issue. So I do appreciate that. Thank you.
Thank you. Any questions or comments for the sponsor? Hearing none. Ready to vote? All those in favor of sending House Bill 2376 as amended to full Health Committee, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Chairman and Committee.
Thank you. We're now calling up item number 4 on our calendars. The action on item number 4, House Bill 2474 by Representative Raper, has been to take this bill off notice. It has been general subbed in the Senate, and the request of the sponsor has been to take House Bill 2474 off notice without objection. We're now on item number 5 on our calendars. House Bill 2222. The deuces are wild for Leader Love. As Leader Love, Leader Love may be outside the hallway. Leader Love. You have a motion. You have a second. We're on item number 5 on our calendars, House Bill 2222. You're recognized. I think you may have some amendatory language as well, Leader Love.
Yes, sir, Mr. Chairman. Thank you, Mr. Chairman, committee members. It would be amendment number 016266.
All right. And that's you have a motion. You have a second. Let's go ahead and place the amendatory language on the bill. The latest amendment in our amendment pack, drafting code 016266. All those in favor of placing this on the bill, please signify by saying aye. Any opposed, please say no. The ayes have it. You're recognized now for a description of your bill as amended.
Thank you, Mr. Chairman. November of last year, I had a chance to meet in person Alonzo Mourning, former NBA star, and he shared with many of us the story of his journey dealing with kidney disease. And he did not know that he had this issue and ignored some of the warning signs from the doctor and discovered that he suffered from this rare kidney disease called APOL1. And then talked about his journey in getting healthy and the need to have more awareness around that. So, Mr. Chairman and members, this particular piece of legislation simply asks that we conduct a review and issue a report to the General Assembly on genetic chronic kidney disease, including variants of APOL1 gene associated with increased risk of end-stage renal disease. The report includes a recommendation on how to increase awareness of chronic kidney disease and APOL1.
Thank you. Thank you for the description there, Leader Love. And I think we've seen this bill, the value of this. It's some data that the Department of Health is currently collecting, and you'll get into a report form is what I'm seeing from
Yes,
this
sir.
amendment. Yeah. Any questions or comments of the presenter? Seeing none, ready to vote? All those in favor of sending House Bill 2222 to, as amended, to full health committee, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill moves forward as amended.
Thank you, Mr. Chairman and committee members.
We're now going to item number 6 on our calendars. And we were joking just a moment ago, several of us have 3 different calendars we're working on, and I've got an iPad here in front of me too. So we're trying to keep track of everything that is in front of us here, and appreciate your patience.
No, thank you, Mr. Chairman. And I think there's an amendment with this bill also.
All right, we'll draw up item number 6 on our calendar, House Bill 2226. You have a motion, you have a second. We're looking at amendment drafting code that will rewrite the bill 015087.
Yes, sir.
All right. We have a motion, got a second. All right, let's go ahead and place this amendment on the bill. All those in favor of placing amendment drafting code 015087 on the bill, please signify by saying aye. Any opposed, please say no. The ayes have it. We're now on your bill as amended, ready for explanation.
Thank you, Mr. Chairman and committee members. A few years back, we created a maternal mortality review team, and it's given us substantial data and allowed us to really analyze ways that we can reduce maternal mortality. This simply adds 4 members from community-based organizations to the maternal mortality review team.
All right, you have heard the explanation. Any questions or comments for the presenter? A question has been called. All those in favor of sending House Bill 2226 as amended to full health committee, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Mr. Chairman. And if I could, there were some members here that I failed to put on to testify, but I will make sure that when we get to full health, that I will have them down to bring testimony about the importance of this bill.
Thank you. And just for a reminder for our members, just make sure to get that to our research staff, and it disseminates to everybody whenever there's a form to fill out to speak. So thank you
Mr.
very
Chairman.
much, Leader.
Yes, thank you, Mr. Chairman and committee members.
Thank you. We're now going on to item number 7 on our calendars. It is a SJR Senate Joint Resolution 848. Representative Stevens, I believe you're carrying that for the senator. We have a motion. We have a second. You are recognized for description of the SJR 848.
Thank you, Mr. Chairman. This Senate Joint Resolution urges the state and TennCare to develop a comprehensive statewide paid family caregiving policy and program in collaboration with consumer stakeholders and advocates by January of 2025 to look at supporting long-term caregivers in our state of Tennessee here.
All right, you've heard a brief description. Any questions of the sponsor? Seeing none, you ready to vote? All right, all those in favor of sending SJR 848 to full health committee, please signify by saying aye. A little bit of levity there. Any opposed, please say no. The ayes have it. Your resolution moves forward.
Thank you, Mr. Chairman and committee.
We had the ayes come somewhat staggered on that vote for folks who could not hear online. There was a staggered aye vote as we went forward. We're now on item number 8 on our calendar, House Bill 1882 by Representative Capley. Representative Capley, do you have a motion? You have a motion. You have a second. You are recognized on your bill, sir.
Thank you, Mr. Chairman. House Bill 1882, very, very simple. All it says that if a patient requests their full medical records under state law right now, healthcare providers have the option to provide a summary instead of the full record. And this will simply say that if the full record is requested, that they will provide that to them. It doesn't have to be in print. It could be in electronic form as well. That's what the bill does.
All right. Thank you very much. You've heard the description. I think we've been working in this arena in the last couple of years and the cost therein. And I'm sure that the other bill will have some effect on this requested bill as well. So I see it working in unison with another piece of legislation we're working on. Any questions or comments on House Bill 1882? All right, all those in favor of sending House Bill 1882 to full Health Committee, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill moves forward. Thank you. All right. We're now on item number 9 on our calendars, House Bill 2458 by Representative Sherrill. Again, this bill has been general subbed in the Senate and will be taken off notice in our subcommittee. Without objection, House Bill 2458 is off notice. We are now on item number 10 on our calendar. House Bill 2375 by Chairman Terry. You have a motion. You have a second. You recognize, sir.
All right, thank you. And eventually I'm going to move to send this to summer study as well. But I do want to say a few words. And what I'm trying to do with this piece of legislation, some other stuff that's out there, is I'm trying to find ways to attract psychiatrists to Tennessee and to improve the access that patients and mid-level providers would have to psychiatrists. The AMA is projecting anywhere between a 37,000 to 124,000 physician shortage by 2034. And we know that Tennessee ranks number 1 for youth access, for mental health services, and number 7 for adults. And while that means that we may be in better shape than other states, we're still dealing with a shortage and a mental health crisis. Thus, we have an issue both on the supply side and the demand side. The issue of shortages isn't just limited to psychiatrists. And while we may be in better shape than other states as it relates to other types of physicians, our nation and state, we're staring at a looming crisis. There are multiple factors that can help or hurt Tennessee on this issue related to the shortages. We must take into account patient safety, patient access, physician-patient relationship, and other things like burnout, billing, recruitment and retention, payment as well. It's a very complex issue, and everyone knows that I have a pretty extensive process when I go through things. And so, yeah, and so this issue really needs to be studied deeply. And so I move that the committee send this bill to summer study.
All right. Thank you very much. And as we have said on a couple other bills already, this has been general subbed in the Senate, and the chairman has expressed the desire to have study on this particular issue. Motion has been for summer study. We have a motion. We have a second. All those in favor of sending this bill to summer study, please signify by saying aye. Aye. Any opposed, please say no. Chairman Terry, you've sent your own bill to summer study. Congratulations.
Good job. Thank you. It's tight. Yeah, it's tight. Yeah.
We are now on item number 11 on our calendars, House Bill 2433, also by Chairman Dr. Terry. You're recognized. You have a motion, you have a second. I believe we have an amendment.
Yes.
Drafting code 015630 on this that will make the bill. We have a motion and we have a second. All those in favor of placing amendment drafting code 015630 on the bill, please signify by saying aye.
Aye.
Any opposed, please say no. The ayes have it. Your bill is amended and ready for discussion. You recognize Dr. Terry.
All right, thank you. And what this bill will do is asking TASER to conduct a study on the effects of vaping and the use of all vapor products by people under age 21.
Thank you. You've heard the description of a TASER study, and vaping, the issue is brought to me on a regular basis from our juvenile court judges, as well as our folks working within school systems. There's a prevalence amongst our young people that is quite frightening, to be truthful, and I look forward to hearing the results of this TASER study should it move forward through finance. Any questions or comments for the sponsor? Hearing none, you ready to vote? All those in favor of sending House Bill 2433 as amended to full Health Committee, please signify by saying aye.
Aye.
Any opposed, please say no. The ayes have it. Your bill moves forward.
Yeah.
We are now on item number 12 on our calendars. We will call up House Bill 2869. You have a motion. You have a second.
Yes, I'm asking the committee to take this bill off notice.
Okay. And once again, there's been no action on this piece of legislation in the Senate as well. So seeing no action in the Senate, item number 12, House Bill 2869, and with the request of the sponsor, this bill will be taken off notice. Without objection, House Bill 2869 off notice. We are now on item number 13 on our calendar, and I will hand the gavel over to Chairman Terry.
That brings us to item number 13, House Bill 1975. Chairman Hawk, you have a motion and a second. You are recognized.
Thank you, Chairman and members. House Bill 1975 is a bill, excuse me, that's dealing with TANF. If you'll recall, we've been working closely with the purposes and the tenets of TANF for the last several years and ensuring that we bring awareness to all the different aspects. This bill is working in conjunction with the Department of Human Services to make sure that the report given to us on a yearly basis has some specific information we're looking at, more specifically in the realm of what are we doing to promote fatherhood and unifying our families across the state of Tennessee and that particular purpose of TANF. So with that description, certainly ask for your support of this legislation, Chairman and members.
Do we have any questions for the sponsor of the bill? All right, seeing none, I do want to thank you for bringing this bill forward. You have worked diligently in this arena on TANF and helping our citizens and our families, and I look forward to this bill in full committee. So without objection, we are voting on House Bill 1975. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to full health.
Thank you, Chairman and members. All right, we are now prepared to draw item number 14 on our calendars. There is Representative McKenzie. You are recognized on House Bill 2406. You have a motion? You have a second. You're recognized for description, sir.
Thank you, Mr. Chair, and point of personal privilege. Thank you for that bill as well. That I'm not just saying that because I'm here. That's a really, really good bill. Thank you for that. Thank you. Good afternoon, committee members. The bill before you is House Bill 2406. The bill requires the Department of Human Services to identify any federal regulations, state laws, or rules that they determine inhibit the department's ability to review and approve applications and deliver benefits for the food assistance program. A department must also identify any federal waivers it deemed necessary to alleviate federal regulatory limitations. This bill also requires that on or before December 31st, 2024, DHS must submit a report to the chairs of the Health Committee in the Senate and the House that details its findings, any waiver of applications it has submitted, and their status. We're also asking that they include recommendations to the General Assembly for any statutory changes that the department deems necessary. And I will say that this bill passed the Senate unanimously on the Senate floor.
Thank you. You've heard description of the legislation. Any questions or comments of the sponsor? Seeing none, you ready to vote? All those in favor of sending House Bill 2406 by Representative McKenzie to full health committee, please signify by saying aye. Aye. Any opposed, please say no. Your bill goes forward. Very good work.
Thank you, Mr. Chair and committee.
Thank you. We're now ready for item number 15 on our calendars, House Bill 2351 by Representative Johnson. Representative Johnson, you have a motion? You have a second. You are recognized on House Bill 2351.
Thank you, Mr. Chair. This is a bill for youth mental health. Recently, Tennessee was added to in the top 10 for youth suicides in the country. I was at NCSL and saw some legislation that was happening in places where they created a program where anyone who was a school-age child could request counseling and be granted that counseling. They would go to a website with their parent, do a screening test, or do a screen, fill out a screening process, and they would receive counseling, a limited number of counseling sessions that they could go to with someone in their county, a therapist in their county. And it was open to anyone to do that. And so what happened is after a couple of years, the program was well used. And after a couple of years, for the first time in Colorado's history, they reduced the number of youth suicides. And this program was being used in all but 2 counties in their state. And that quickly it caught on. However, it's not as expensive a program as you would think. And we have our mental health trust fund here in Tennessee. And the cost of this bill would be about the cost of what interest is earned on that youth mental health trust fund in Tennessee. And this is a program that captures every single young person in the state. Right now, they're thinking about doing it based on grants that are hit or miss across the state, different types of programs like that. And this is one that we have seen that has proven to be successful. And I just think it would be a great fit for Tennessee, that it would give everyone access to the care that they needed. And what they can do is, with whoever their assigned therapist is, they would determine from there if they needed to add any more visits. And that's up to, in Colorado at the max right now, that's costing them about between 8 and 9 million per year for that program, which is about what the interest rate is, what's interest that's earned on our mental health trust fund. So far, we have not used any of that money in the mental health trust fund to go towards mental health. We've only used it to pay the fund's financial managers. So I think that this would be a great opportunity for Tennessee to do something proactive for mental health, that we're really seeing such an issue, especially since COVID, something that would help kids in every single county in Tennessee.
Thank you for that description. Chairman Leatherwood, you're recognized.
Thank you, Mr. Chairman. I do have some concerns with the bill. While the objectives are obviously good, those are the objectives already set out in the Mental Health Endowment Fund. And as I understand this fund, there's about $6 million that has been earned. As you alluded to, we don't go into the principal, we just invest the earnings. And there are other programs that have been making their way through the process to be approved for funds. So one of the issues I have, one, this is already what the fund was established for, but 2, this would be taking money away from other programs that are working their way through the approval process at this point. So.
And I understand your point.
You're recognized.
I'm sorry. I understand your point. And, but what my concern is as those grants are granted, it's going to be piecemeal across the state. How long is it going to take to figure out which one's working, which one isn't working, when we could have something that could serve everyone across the state and something that's proven to be successful?
Chairman Leatherwood, you're recognized.
Oh, just a quick little response. Having lived in Colorado for a while, great job, worked at a ski resort and everything.
Cool.
Everything that might work in Colorado might not work here. And having, you can describe it piecemeal, or you could say having a couple of pilot projects to look at different methods could be a better way to go. But regardless, again, I appreciate what you're attempting to do, but feel like the process that's already ongoing would probably be the better way to stay that course right now.
Yeah, I don't.
You recognized?
I don't really necessarily agree that but what this done has served every child that needed to be served. And that is why I think that this is a good idea for any state. And when we see that everyone who needs to be treated is being treated, that's when we see success in all the states. That's demonstrated to be true.
Chairman Williams, you're recognized.
Thank you, Representative, for the bill. I think it's noble. Two concerns I had was we invested a lot of money last year in putting a counselor in every school system or every county across the state, which I think is very important for us to do. Of course, secondly, the whole reason why this body, you included, invested that $250 million was because we wanted to have a elongated plan as it relates to something that was sustainable. One of the concerns I have about your plan is that it's not sustainable. It ends next year. And so my concern is that if we invest these dollars in this short period of time, of which the fiscal note doesn't really describe how much money that would be, but all of a sudden these services that we sought to provide for these youth are now gone. And so that's a concern I have. I know that in talking to the treasurer's office about those returns, because we invested those money in long-term bonds, and then because of the actions of others, those rate of returns have not been as good as, say, our OPEB programs or other those. But we have been able to glean a little bit of money to make some investment. I think the governor's done that, proposed that in his budget this year. And for me, my big concern is that we're putting a Band-Aid on it and not having an elongated approach as to what would be the best for these youth in our communities. As I said before, I think it's a noble cause, and I appreciate you bringing it. I just don't think that the timing right now is good based upon that. So just thought I'd share that with you. Thank you.
You're recognized.
Yes, thank you. I guess the situation, that's kind of the way it's been done in a few states, is where they make sure that it's being successful before they continue. I know specifically in Colorado, because I talked to that representative, that they extended it each year. And then this year, because of the drop in the youth suicide rate, this year they are going to make it permanent. And it has, had that success. And counselors are great, but they're not therapists, and they're not trained to address you have conversations and talk with them, but sometimes they get co-opted, unfortunately, in schools to do other jobs that aren't even related to that. So this is making sure that we have someone who can go deeper with a child who feels that they need that. So thank you. But I understand. I get your comment.
Thank you. Any further questions or comments? You ready to vote? All those in favor of sending House Bill 2351 to full health committee, please signify by saying aye. Aye. Any opposed, please say no. No. The noes have it. If you'd like to request to be on the side of yes, please let Ms. Adams know. The noes have it. The bill fails. We are now on item number, excuse me as I go through my notes. We're now on item number 16, House Bill 2600 by Representative Johnson. We have a motion? We have a second. Chairman Williams, you're recognized.
Thank you, Chairman. As Chairman Terry alluded to previously on 3 of his other bills, we're in the back half of the session, and he self-inflicted summer study on his. I would make a motion that we'd send this bill to summer study because it has been gen subbed in the Senate.
Could I?
We have a motion. We have a second.
We have people who drove 5 hours to testify on this bill.
Well, we have a motion on the bill, House Bill 2600. The motion has
5
been
hours.
the motion has been for summer study, and it's been seconded. Any debate on the motion? Hearing none, are you ready to vote? All those in favor of sending House Bill 2600 to summer study committee, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. If you'd like to be recorded as a no, please let the clerk know. Thank you. We are now on item number 17 on our calendars, House Bill 1960 by Representative Powell. Representative Powell, you are recognized.
Thank you.
Motion? You have a second.
And I do have an amendment, Mr. Chairman.
Yes. We're looking at amendment to rewrite the bill, drafting code 013823. Is that what you have, Representative Powell?
Yes, that is,
Yes.
Mr. Chairman.
Do we have a motion on the amendment? You have a motion? You have a second. Let's go ahead and place the amendment, drafting code 013823 on the bill. Please signify by saying aye. Aye. Once again, staggered on the amendment adoption. Any opposed to adopting amendment draft code 013823? Any noes, please say no. The ayes have it. Your bill is, your amendment is adopted, you're recognized on the bill as amended. You're
Uh,
recognized, sir.
So thank you, Mr. Chairman. So what this bill does as amended, and actually this is an issue that the late Senator Douglas Henry was interested in. And so I didn't have the honor of working on this with him. But our here in Nashville, and with the amendment, this would just apply to the Nashville General Hospital, that we created a program where our city employees could benefit from being able to utilize the local hospital, and in return, the hospital would waive both deductible and their co-payments. And so this has been a tremendous savings for a lot of different reasons. It's also been helpful to the local public hospital. So the goal here, and we're hopeful this will work here in Nashville, we can look at expanding this beyond the state, is to help our state employees be able to utilize the local public hospital here, and then they would be able to waive those co-pays and deductibles. This would also help make healthcare more affordable for those state employees. This is totally permissive. It would give them that choice to utilize that service, and then also just I think be a win for overall for the state and for the local hospital. So as we look to expand this beyond, I stand ready for questions.
Thank you. We do have a list beginning. Representative Jernigan, Chairman Jernigan, you're recognized.
Thank you very much. And Bo and I are probably going to say the same thing. But when Representative Mitchell and I, we were both on the Metro Council when we did this program. Was it your bill? And so we
don't hurt my bill.
Okay. It must have been my bill then. So anyway, and it was when we did that to exempt our Metro employees, it was a tremendous success, and it gave an opportunity to save a little bit for those who for the copay, and it gave a little boost to the hospital. So it's been successful at that level, and I would see no doubt it wouldn't be at the state level.
Chairman Williams, you're recognized.
Thank you. Thanks for the bill. Because I wasn't a Metro or state employee, I don't understand this. So what would happen? Would the hospital, would they add this to their already growing charity care call? I mean, how do they have the ability financially to waive that cost, I guess?
You recognize Representative Powell.
Sure. So that's a great question. They would still, for example, if you waive like a 20% copay, they'd still have the 80% that they're making for the delivery of care. And they would realize certain efficiencies, also having more people go to seek care. So ultimately, it's been a financial gain for the public hospitals because it utilizes more people to go there. And actually, as a state employee, you'd also be able to utilize this benefit.
Thanks.
You recognize Chairman Williams.
Thank you. As somebody who has a locally owned hospital, they'd probably be upset if I came to your hospital, but thanks for the offer. But I will say that my only concern is how we do that. So it's almost like, I guess, from a financial standpoint, like if someone does not have the ability to pay, sometimes at the end of their medical bills, they're able to go back to the hospital and negotiate other terms. I guess in essence, what you're doing here is you're pre-negotiating those terms through the adoption of this bill.
Correct. This just gives them the ability to negotiate those terms on the front end, and it would be unilateral across the board.
Okay. Thank you.
Okay, thank you. And before we go on, I just interject a question here. Is this an option for hospitals at the moment? Is this something that they could do? Okay, and you recognize
it is not, and that's one of the key things of this bill. And like I said, this would just be and it's permissive, but it would just be for local hospital here. We looked at expanding this further, but I think this is a good first step because we've got a lot of public hospitals in West Tennessee, East Tennessee. This could be a tremendous benefit both for the hospital, state employees, and the community.
Okay, and I will remind folks that as we adopted the amendment, Nashville General Hospital is the hospital of concern. Representative Mitchell, you're recognized.
Yeah, thank you, Mr. Chairman. Yeah, and Councilman Gerrymandered and I came up with this when I was on the Metro Council, and it saved millions of dollars. And to Representative Williams, I mean, if this is successful, his county-owned hospital, they would just contract just like Metro will contract with this. It's just volume. It's just getting people in the door. The more volume these hospitals have, that's where they'll get the savings. And I mean, it works, and and it's going to save the state employees money by not having that deductible.
Representative Powell, I could tell you were worried that Representative Mitchell was speaking, so you're recognized, sir.
No, and I was going to say, if you probably don't know Councilman Maynard, Representative Williams, but if you knew that Councilman Maynard and Councilman Mitchell could agree on a bill, then certainly you and Representative Mitchell could agree on this. So.
Chairman Williams, you're recognized.
Thank you. I appreciate that. You really had my support until Representative Mitchell said that he helped craft the idea. But I will say I do have some hesitancy about it, just in complete transparency, mainly because we also don't, we have to have a legislative change because it's important in order for your community, your district, and I recognize that. My only fear is that if we get into some kind of competitive backlash that might occur from other hospitals that are in your community. My community is a little different. We're the only one in 8 counties. It's completely different. There aren't others. And so I in transparency, I'm gonna support your bill today, but I do want to look a little bit more into how that would impact the other hospitals as it relates to their ability and whether they could waive that right as well.
Representative Powell, you're recognized.
I appreciate that. I'm willing to come talk to you, and I'll have some of them come talk to you about the ways that's impacted the local community here and some of the upside. But I appreciate you that, and want to remind you it's just simply as a choice.
All right, thank you. And I will note, as I have noted on some others, as we discuss policy, this may have a fiscal impact from our Department of Finance and Administration. So just heads up as we do look at potential pitfalls on the road ahead. Any more comments or questions for the sponsor? We ready to vote? All those in favor of sending House Bill 1960 as amended to full Health Committee, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Mr. Chairman, committee.
We're now calling up item number 18 on the calendars, House Bill 1962 by Representative Powell. You have a motion? You have a second. You are recognized, and I think we've got some amendatory language there as well.
I do. It's Amendment 15394.
All right. We have an amendment drafting code 015394 to place on the bill. All those in favor of adopting amendment drafting code 015394, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill is amended. Whoop. We will reconsider our actions. Just to make sure. We have before us, we have House Bill 1962. We have heard a motion and a second on House Bill 1962. We now have a motion. We have a second on amendment drafting code 015394. All those in favor of placing, we have a motion. We have a second on the amendment. All those in favor of placing this amendment on the bill, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill is amended now for discussion. You recognize, sir.
Thank you, Mr. Chairman. So this bill, as amended, would introduce a requirement for the Tennessee Department of Human Services to conduct an annual cost estimation model study for daycare rates, a thing that a lot of us know how costly that is. This model is essential for accurately assessing the financial needs of daycare providers and ensuring the affordability and accessibility of child care services for families. 26 states now either reimburse all providers at or above 75th percentile of the market rate survey. Some of those states include Utah, Kentucky, Louisiana, Texas, Kansas, North Dakota, and Iowa. So in compliance with federal law and regulations, the department will use the result of the cost estimation model study to determine an annual reimbursement amount for lower income families. And then this bill mandates that the commissioner of the department to report the results of the cost estimation model on an annual basis to the governor of the General Assembly. With that, I stand ready for questions.
Okay. You've heard that. We do have any questions or comments for the presenter at the moment. We do have someone from Department of Human Services who has asked to speak on House Bill 1962.
Sure.
Seeing no objection, we will go out of session, and we have Ms. Callan Schmidt Baggett to speak. If you could please tell us who you are, who you're with, and what you'd like us to know on the legislation recognized.
Good afternoon. My name is Callan Schmid-Baggett. I'm the Assistant Commissioner for External Affairs at the Department of Human Services. I did put a card in that said we were opposed as amended. We are comfortable with the amendment. And if I can just give a little bit of background, if you're okay, sponsor, as to what this is for our child care reimbursement rates that we give to providers. I heard some states that did it on his end. When we did our research, our team found that New Mexico and DC were the only states or territories that used this at the time of the article and information that we had. The cost estimation model looks at what is the cost of running a child care center from a provider perspective. The department currently uses the market rate study to formulate those rates, and we contract with the Boyd Center to formulate those rates, and then every October 1st, we send notification to the legislature about the change in those provider reimbursement rates. With that, I'll stop for questions if y'all have any.
Thank you. Any questions or comments for the presenter? Chairman Terry, you're recognized.
Thank you. And so I guess based on how this may be calculated versus how it's currently calculated, I was looking at the potential fiscal impact. Are the funds there for the state to be able to pay this if it goes up? And if so, how much would it go up?
You're recognized.
Thank you for the question. So we have not done a cost estimation model yet in Tennessee, so we don't know what the rate would be or what it would go up as. What we've seen in other states and territories that have implemented it, it does raise provider reimbursement rates. We receive child care development funds from the federal government that are what we use to reimburse for our certificate program. We have seen a higher reimbursement rates, and in some states like New Mexico, they reimbursed at a higher rate. They used up all of their CCDF dollars. They have a child care trust fund that is state dollars that they can go in and supplement behind, because it did use up all of their CCDF dollars and almost created a wait list, but they were able to use the state dollars to come in and use the wait list to cover the wait list with the state dollars. So they did have to expand their child care reimbursement program, but they were able to do those costs. But we see with a cost estimation model, the rates do go up.
Chairman Terry.
So I guess that's my point that I'm trying to get at is how much do we have in reserve for the CCDF? Is there concern that if we change the model that we're going to exceed that? Because I don't recall those in the top of my head, but I do know that we've had issues and we've had a reserve. So that's my question is, can we absorb this or are we going to be at risk?
You recognized.
With the legislation authorizes us to do a market rate study and the cost estimation model, and then DHS will determine the best provider reimbursement rate to raise those rates at that point. There are some concerns that the cost estimation model could create a wait list for long term, and I don't have the reserve rates the reserve amount in front of me. I'll be happy to get that to you. We have had, we get about $220 million per year for child care development fund dollars. We've used that for a variety of purposes. There is some concern about the cost estimation model from our team, but with the amendment in front of you all, it does allow us to continue to do the market rate study, which looks at the whole picture of child care rather than just the provider cost. So
Chairman Terry.
Okay, yeah. So to clarify, you'll have two sets of numbers. You can decide which one to go on, but then we will be able to determine how much we have over here in the CCDF. And so whether it's after this study, you raise the rates, or the number that we get the information, if this bill passes, we can come back and say, you're going to raise these rates to that based off this. But as this is written, you can still stay at the lower rate to make sure we don't strip this.
yes, sir, we can still use both.
Thank you.
Any further questions or comments while we're out of session? Thank you very much. Thank you. We are back in session. And continuing conversation on House Bill 1962. Any questions or comments for the sponsor? Question has been called. All those in favor of sending House Bill 1962 as amended to full Health Committee, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Mr. Chairman.
Thank you. We are now on item number 19 on our calendars. We will draw up House Joint Resolution 82. You have a motion, you have a second.
So this
You're
one,
recognized.
Thank you, Mr. Chairman. This one might be a little heavier lift here, but one of the issues that we've visited every year is medical cannabis, and I think one of the issues there is it's a very difficult vote for a lot of folks. So this would actually shift that vote. We'd have to vote on this as a General Assembly, but it would place it as a constitutional amendment that then the people could vote on, that'll allow for the consideration of medical cannabis to be used in the state of Tennessee. It would legalize it, would direct the department to develop an entire protocol around it. And then also the 4% of the proceeds would be dedicated to a fund that would provide important healthcare services, mental support health, rehabilitation programs, and others for veterans. So that is the purpose of the resolution, and it's a little bit of a shift to change it from, I know we've looked at some bills over the years, just have an House Joint Resolution.
Thank you. Chairman Williams, you're recognized.
Thank you. Is there any specifics in the resolution that says for what illnesses would be, or, as somebody who might be the only person who's carried a bill in the House of Representatives as it relates to medical marijuana that's a Republican, I'm really, what I'm concerned is,
Terry did it.
what I'm concerned that what might happen is that it's not specific enough to say what it's for. For instance, does it determine that these are for stage 4 cancers or diseases that are called terminally ill, or could we have it for glaucoma and IBS?
Representative Powell.
Sure. So it would allow actually the Department of Health to come up with those recommendations of what would be allowed for. I'm certainly, if you want to put that into the constitutional amendment and specify, I'd be welcome those changes if we get this out of this committee today.
Yeah, as somebody who's worked in this space, I'm not going to be supporting it today. I recognize there are people like my family members who there's always a lingering question in your mind: would this been better for them or not? But because of the way it's drafted, not because of the subject matter, I'm not going to support it today. But I appreciate you bringing it.
Thank you.
Thank you, Chairman Jernigan.
Thank you. And you know what? I will attest. I don't know if you remember. Gosh, when I first got in, we were in my office talking. Was it your father-in-law? Yeah. And so you have been steadfast on this issue, and so is Dr. Terry. I don't want to leave him out. But what I love about this is that it's going to go before the people, and they should have an opportunity to vote on God's plan. So thank you for bringing this.
Lots going through my head right now, Chairman Jernigan, and I'll leave it in my head at the moment. Chairman Terry, you're recognized.
Thank you, and I appreciate the sponsor for bringing the piece of legislation. And obviously, I've brought several bills in the past, including the bill on our Cannabis Commission relative to this, and for multiple different diagnoses that patients may have. And so generally, I'm supportive of helping patients getting alternatives to opioids or other high-risk medicines. I do, but in any bill that I've ever run, obviously, I mean, I'm an asthmatic, and I've not ever supported anything. Obviously, I had a Tasser bill earlier today dealing with vaping, but I don't support smoking, and I've not ever put forth a bill related to cannabis on anything that might be a rec form. And I often use the acronym OATS, and the oral, oral, aerosol, topical, and believe it or not, suppository. From that, there are some patients that have seizure disorders, can't swallow pills, can't coordinate breathing treatments. Does this? I'm not seeing in this where this is limited to that. Where I'm looking on this is that it doesn't specify that it couldn't be smoking, and it couldn't be some rec form. Is that Can you speak to that?
So
There's a pal you recognized.
it is not. I mean, it says medical cannabis use.
Just
So,
use,
yeah.
okay.
So it does not. But again, I appreciate this committee's this comment and feedback, and keep working on this issue. I will say too, another reason I think it's important to put this before the voters is I've seen numerous polls that show overwhelming public support for this, and we're seeing surrounding states adopting this, and so I think it's better to have the laws in the books here in our state rather than Tennesseans having to go out of state for this sometimes very necessary things that, as you know, can oftentimes have conditions where this will be very helpful and is needed.
Thank you.
Thanks.
Further questions or comments? Seeing none, are you ready to vote? All those in favor of sending House Joint Resolution 82 to Full Health Committee, please signify by saying aye. Aye. Any noes, please say no. No. The noes have it. Your bill fails. If you'd like to be recorded as a yes, please let the clerk know. And Representative Powell, as the old song goes, 2 out of 3 ain't bad. All right, we are now ready for call up item number 20. And Representative Harris has requested, you're recognized, sir.
Thank you, Chairman. And so what I'm going to ask is if I could go out of order and do House Bill 21, number 21 before 20, if that's possible.
Okay.
Seeing where we just left off of, I just want to make sure I go to that one first.
All right, seeing no objection, as requested by the bill sponsor, we are going to also his bill, item number 21 on our calendar, House Bill 2511 by Representative Harris. You have a motion? You have a second. You are recognized for explanations, sir, on House Bill 2511.
Thank you, Chairman, and to the committee. A federal court ordered in 2022 that R.J. Reynolds Tobacco and Phillips Morris USA to state in all places that sell tobacco that smoking tobacco kills on average 1,200 Americans every day, and that more people die every year from smoking tobacco than from murder, AIDS, suicide, drugs, car crashes, and alcohol combined. House Bill 2511 prohibits the sale or distribution of tobacco products to persons born on or after January 1st, 2007. It specifies that it is not a violation of the Prevention of Youth Access to Tobacco, Smoking Hemp, and Vapor Products Act, or any other statute for a person born on or after January 1st, 2007 to use or send a person born on or after January 1st, 2007 to purchase any such products for the purpose of aiding law enforcement. This bill would require that an age attesting statement for any sale of distribution of tobacco through the mail be provided for individuals of that age. This bill would prohibit the sale of tobacco or tobacco products through a vending machine. And if it is a vape with tobacco in it, cigar, or flavored shisha, they can still purchase those items if born after 2007 and older than 21. So it does not prohibit the consumption on site at a cigar lounge, hookah lounge, or whatnot, just the purchase of it if you go to the gas station for those who are born after January 1st, 2007. Currently, it is a violation of both federal and state law to sell tobacco or tobacco products to persons who are under 21 years of age. This just adds the provision of under 21 years of age, but January 1st, 2007 as well, as we are working to make better health outcomes for our future generations. And so with that, I ask for a positive recommendation.
Thank you. And quick question, and we'll recognize, if you'd like to speak on the bill, please let Mr. Critchfield know. Are we looking at, we're setting a date of January 1, 2007 in perpetuity?
Yes.
You're recognized.
Thank you, Chairman. And so if an individual who is was born in 2007, they're probably like 16 years old right now. By the time they turn 21, they will not be able to access purchasing tobacco. Now, if an individual is 40 years old right now and they go in, they can go ahead and keep on purchasing because they're still used to it. We're not going to take that away from you. But what we're trying to do is try to limit that from individuals coming up in the future.
Okay, thank you very much. Okay. Thank you very much. Anyone, any comments or questions of the sponsor? Representative Mitchell, you recognize.
Yeah, thank you, Mr. Chair. Do you know how much that'll save TennCare per year?
I actually don't
You
know
recognize?
thank you, Chairman. I don't necessarily know the number to that, but I would think that the number is going to be quite high. We could ask the legal, maybe legal has some information around that.
She's
I
legal,
would
not
think
financial.
Research, I'm sorry, research probably would have. the
Yeah,
answer to that,
I'd
but
say
it would
tens of
be-
millions, if not 100 million.
Thank you for
Thank
giving.
you.
Thank you, Representative Mitchell, for your financial report there. That you saved research from having to answer that question. So. Representative Harris, you're
And I
recognized.
will say that as we are constantly looking at ways to make sure that our future generations improve and get the healthcare that they need, this is something that's very important. We're seeing states like California and Massachusetts that have already implemented some sort of legislation like this, but it just becomes more and more important as we move forward, just to make sure that we're not putting out something that an individual can consume that is hurting them, and we're participating in that process.
Thank you. Any further questions or comments? Chairman Terry, you're recognized.
Yeah, thank you. And I'm not sure why I asked to be recognized on this, because I'm not sure I've formulated my comments on this. I am, and I, this, the intent is good. I'm not sure of the, I'm trying to go through my process on this and the consequences and this, that, and the other of that. I'm, most people know I'm generally liberty minded on this, and so I've got a conflict with that from a health. I don't know. I just think this bill needs more study, but I don't know that I'm there with you on it today. I could potentially get there, but I don't know. I don't know that I have a question for you. I'm just conflicted, and that's probably where I'm going to be on the bill.
Thank you. You recognize.
Thank you, Chairman. Both chairmen. Thank you.
Thank you.
Well, this is just a great opportunity to see where we kind of can stand as far as folks' health for the future. So just looking to see how the discussion goes.
Okay. Are you ready to vote? All right. All those in favor of sending House Bill 2511 to full health committee, please signify by saying aye. Any opposed, please say no. The noes have it.
A very light no. I'll take that.
Very light no. And I think you've heard the bill fails,
Yes.
but I think you've heard from the committee the desire to work in this space in the years to come. And thank you for your diligence on this particular issue. If you'd like to be recorded as a yes on the legislation on the, then please let Ms. Adams know. Once again, the House Bill 2511 fails, but with some work to do in the future. We're now jumping back to item number 20 on our calendar, House Bill 2502 by Representative Harris.
Pay attention.
Do we have you have a motion? You have a second. You're recognized, Representative Harris.
All right. Thank you, Chairman. House Bill 2502 enacts the Tennessee Medical Autonomy Related to Cannabis Act, which authorizes the possession and transport of marijuana in permitted amounts for patients diagnosed with at least one qualifying condition. There was a question earlier about the conditions, and I can list those in a moment. Tennessee's motto is agriculture and commerce. And according to the National Conference of State Legislatures, at least 37 states have a marijuana regulated structure of some sort. And this bill is good for Tennesseans. As referenced in the Bible, Genesis 1:29 states that, "And God said, Behold, I have given you every herb bearing seed, which is upon the face of all the earth, and every tree in which is the fruit of a tree yielding seed. To you, this shall be meat." And so House Bill 2502 establishes medical cannabis, medical marijuana in our state. This bill would require the Department of Health to promulgate rules and provide appropriate forms on the department's website. It would establish licensure process and revocation process for various areas and instances in which possession or consumption of medical marijuana or marijuana products are prohibited. And with this language, House Bill 2502 would establish that the sale of marijuana and marijuana products are subject to the state and local sales and use tax, as well as an additional 3% marijuana tax and local governments can establish up to 3%. The proceeds of the 3% state tax, in addition to the established state sales tax, must be allocated as follows: 25% to the Department of Agriculture for enforcement, education, and marketing programs related to the promotion and implementation of this act. including public safety campaigns and grant initiatives focused on economic development. 35% to the Department of Safety for training and education of law enforcement agencies and officers with regards to state cannabis-related laws, the support of law enforcement officers injured.
Of parents, veterans, citizens, and state lawmakers who have stated that the products made or derived from medical cannabis have helped or have shown the ability to possibly help them with medical conditions ranging from war, disease, accidents, or conditions starting at birth. I can add to those stories having lost a 16-year-old daughter in 2007 to bone cancer, where a derivative of medical cannabis helped cope with some of the symptoms that she had. Much has changed since last year when this body met. The Department of Health and Human Services and the FDA have come on board saying there's conclusive evidence that medical cannabis has benefits for diseases of the body. It's currently before the DEA, and the current estimate is somewhere in the coming weeks, they will take it off Schedule 1. Schedule 1 has been an issue, and I'll address some more of that in just a second. This past November, the U.S. House and Senate approved H.R. 4366, the Consolidated Appropriations Act, as amended for 2024, which just got signed into law. The bill allows doctors at the Department of Veteran Affairs to talk about medical cannabis recommendations with veterans in the states that have full-blown medical cannabis programs. Surrounding Tennessee, only 2 other states do not have full-blown programs. Our members that represent the state of Tennessee supported this effort. I submit to you the concerns that medical cannabis is not real or doesn't help has been put to rest by the HHS, the FDA, and within Tennessee law, which lists 9 specific conditions of which medical cannabis can help. There's been the issue of Schedule 1. Current laws on the books for Tennessee, if we're worried about Schedule 1, we've already approved laws that are in violation of Schedule 1. When we went to strengths of THC to 0.9, when we allowed citizens to go outside of the state to get the drug and bring it back into the state, and we allow our doctors to talk about that possibility, all those technically violate Schedule 1. And even with the federal government, we have drugs which are derived specifically and only from medical cannabis, which are in use in the medical conditions. Other issues we've heard, and I've heard Colorado mentioned today, Colorado is probably the poorest example of a medical cannabis program, and the worry that it would go to river of legislators. I submit to you, study the program from the state of Pennsylvania. They approved medical cannabis in 2016, got it fully operational in 2018. They have not gone recreational, and yet they have a solid program of which hundreds of thousands of people have benefited.
Thank you, Mr. Summers. We're about to run out of time.
Okay, sir. But again, on behalf of the veterans, I ask you to support this bill. I'd be glad to try to answer any other questions you may have. Thank you, sir.
Thank you. Representative Mitchell, you're recognized.
Yeah, thank you, Mr. Chairman. Yeah, I know the veterans and members of TNVET in particular have approached legislators over the last several years,
yes,
asking for support of a comprehensive medical marijuana cannabis program, often called seed to sale operations. You touched on some of those concerns and addressed them in your comments. What other issues and concerns have legislators presented to you, and what has been your response to them?
Well, as our veterans, like I said, we have our Veterans Day on the Hill, which many of our people come in and visit you at your offices. One of the issues that has been brought before us is, well, there's no dosing guidelines, medical guidelines on how to handle that. That is actually incorrect. The 38 states that have medical cannabis programs have derived dosage usages and which diseases they work at. To further show the seriousness of the medical community on this, doctors and pharmacists now can gain certifications and additional certifications on medical cannabis and how to work with it, how to work with your patients, which diseases it's effective for. So that's one of the things that we've looked at. Again, going back, I'll touch back on Colorado. With the Pennsylvania program, it's been in operation fully since 2018. There have been some growing pains. Each year they may do some adjustments in this. But in this, and that's where I know the bill, and talking to Representative Harris, is if we need to make adjustments or amendments, we're fully supportive of that. And I'll tell you, in the Pennsylvania program, the stores that oversee medical cannabis are overseen by pharmacists and or doctors, as the case may be. So there is a track record of where it comes from the doctor to the store where the medical cannabis is. They have listed specifically what forms of medical cannabis are useful for them. And that's how it's prescribed and tracked. So there are model programs out there, I think, that address the concerns that some of the legislators have. And again, we hear the recreational. I actually had one legislator says, when I hear you say medical cannabis, I hear recreational. And Colorado was the first state mentioned on that. Again, Pennsylvania's been in operation since 2018. No recreational. It's up to this legislative body to decide if we'll ever take that final step. So we see the two as separate issues.
Thank you, Mr. Summers.
Thank you, sir. We appreciate your
Thank
time.
you. We're back in session. All right, we're on House Bill 2502. Any questions or comments for the sponsor? Closing comments, Representative Harris.
Thank you, Chairman, and to the committee. Again, I put this forward. I know that we have went year after year speaking about medical marijuana as a whole, and I think that we've come up with a great concept here at this point. I went back multiple years back to when Representative Williams was kind of in the lead, and went through and listened to a lot of the testimony and comments from back then as well. So we put a lot of energy into making sure that this was right this time. We may very well see later on in this year where it comes off of Schedule 1 and becomes a prescription regulated drug on Schedule 3 potentially. And so we would be ahead of what the process would be in just getting this at least started or moved through the process. So I would love to see further conversation on this in full committee and would ask for a positive recommendation out of this one.
All right. Are you ready to vote? All those in favor of sending House Bill 2502 to full health committee, please signify by saying aye. Aye. Any noes, please say no. No. The noes have it. The no is on the prevailing side.
Thank you, committee, and thank you, Chairman. I appreciate it.
Thank you. The bill fails. House Bill 2502 fails. If someone would like to be indicated as voting yes, please let the clerk know. We are now on to item number 22 on our calendars, House Bill 1585 by Representative Pearson. All right, well, item 22, we'll call up House Bill 1585. You have a motion, you have a second. You're recognized.
Thank you, Chairman.
I think we have some amendatory language as well.
Yes, changing the date from 24 to 25.
All right, let's go ahead and put the amendment on the bill. Drafting code 013810. We have a motion.
That's right.
We have a second. All those in favor of placing the amendment 013810 on the bill, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill is amended and ready for explanation. You're recognized.
Thank you so much, Mr. Chairman, members of the committee. Before you is a bill that is going to hopefully help our young people in particular as it relates to mental health care. I'll tell you what the bill does and give you just a few examples. It's going to add new section to Title 33, Chapter 1, Part 3 of this section in our code that outlines the general duties and obligations of the Department of Mental Health and Substance Abuse Services in order that they would develop and implement a public awareness campaign focused on mental health and firearm safety. Subsection B, it does not prohibit any county health department from developing its own public awareness campaign materials or using other materials the county health department deems appropriate. One of the things that I have found, and you all know in understanding the issue of gun violence that we have, is a lot of our kids are actually and unfortunately dying due to suicide with firearms. And if you go today to our site on youth and young adult suicide prevention and mental health awareness on the Tennessee Department of Health's website, the only thing that's there is a link to some grants from 2019. And so right now we don't have any information related to this on our website. And so this would put something like Know the Signs from Sandy Hook Promise or just available mental health resources onto our website and share that out for the public, particularly for kids. This would help, I believe, in a profound way to ensure young people are getting access to resources, or even adults or parents will have access to resources for young people to help them. The Tennessee Department of Health actually created this amazing suicide prevention report in 2021. And one of the things that they ask of the state is to spread awareness of suicide and encourage help-seeking behavior. And so I believe this is in line with one of the calls to action from the Tennessee Department of Health. It's just a public awareness campaign, and it can be done obviously on our website and other digital media. So I don't think it would be that significant or substantial in cost, but could have significant impact. And so with that, Mr. Chairman, I renew my motion.
The motion resides with the committee and the chair.
Okay.
much like some other bills that we've seen today, there's really no action on this in the Senate. Happy to take this bill to a vote if you'd like. Any questions or comments of the committee members? Hearing none, you ready to vote? All those in favor of sending House Bill 1585 to full committee, please signify by saying aye. Aye. Any opposed, please say no. No. The noes have it. Your bill fails. If you'd like to be recorded as a yes, please let the clerk know. We are now on item number 23 on the calendar's House Bill 2334 by Representative Pearson. You have a motion? You have a second. You're recognized, sir.
Of Intellectual and Developmental Disabilities to conduct a study and submit a report to the state concerning the level of compliance with the law of each healthcare facility in the state charged with providing services to the elderly and individuals with disabilities. My bill would require the Department of Health to make reports accessible to the public on their website. This legislation is particularly important in my district, and you probably have seen this before, where you've got notifications about one of the facilities in the district being out of compliance, and yet there's nowhere in the public for you to be able to access that information. This would ensure that our seniors are obviously being cared for, that we're getting the information that's necessary to make sure that the facilities are in compliance. And for my population and our demographic, which is I serve a lot of seniors in District 86, I know that it is really important that our Department of Health does all that it can to ensure that these facilities are in compliance and that we are protecting the health and well-being of our constituents. And this would ensure that the General Assembly has provided the necessary information to make sure that those protections and the accountability that's required happens as well. There are many common types of elder abuse, from physical abuse, emotional abuse, neglect, abandonment, and there are so many victims who are a part of our state and in this country. And we want to make sure that the facilities that are supposed to be taking care of the elderly actually do that work. And so this would just require a report to be done as it relates to making sure that the facilities are in compliance, and if they are not, for us to be notified of that.
Thank you for the explanation. Chairman Jernigan, you're recognized.
Thank you. And sponsor, this is a good bill. We just in a previous committee passed something frankly identical for DCS to look at the facilities for children. And what this does, it just gives an opportunity for frankly the public as well as the legislature to see. Is yours annually?
Yes. Well,
To
it's in
see
January of each year.
annually what the report is and what the audit is. So this is a good bill, and I'll be in favor of it.
Thank you. Any further questions or comments? Seeing none, you ready to vote? All those in favor of sending House Bill 2334 to full health committee, please signify by saying aye. Any opposed, please say no. The noes have it. Your bill fails. If you'd like to be recorded as a yes, please let the clerk know. Thank you very much.
Thank you, Chairman and Committee.
Thank you. All right, as we go through expeditiously, item number 24 on our calendar, House Bill 2225 by Leader Love has been taken off notice. Once again, without objection, House Bill 2225 by Representative Love off notice. We're gonna push through as much as we can with 2 minutes to go. I've got Chair Lady Camper here and Chairman Vaughn here. Chairman Vaughn, item number 25, House Bill 2011. Chairman Vaughn, we have a motion? We have a second. You're recognized.
Thank you, Mr. Chairman and committee. First, let me be the first to say that whoever your space planner is, I think we need to have a talk. Y'all, this committee deserves a bigger room. Thank you. This is
we have some amendatory language. What amendment would you like to go with, Chairman Vaughn?
yes, sir. Let's go with 015883.
You've heard the amendment to adopt 015883. All those in favor of placing this amendment on the bill, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill is amended, and you're ready for explanation on the bill amended.
Thank you, sir. This is an exciting Electronic Medical Records Act. The bill prohibits a covered entity from entering into a contract with a person or entity that includes terms that restrict a patient or a patient's representative from accessing the patient's electronic health records. It clarifies it's an unlawful restraint of trade or commerce. It also requires a health insurance entity for purpose of facilitating patient and provider access to health information to establish and maintain APIs, which are application programming interfaces. And then it also provides that certain reports must not be disclosed to a patient as part of the patient's electronic health record until 72 hours after the results. That way those
those those test results can be delivered in person as opposed to someone finding it out over a testing website.
Thank you. You've heard the explanation. Any questions or comments for the sponsor? Question has been called. All those in favor of sending House Bill 2011 as amended to full health, please signify by saying aye. Any opposed, please say no. The bill moves forward. The ayes have it. You're now recognized on House Bill 2093. Do you have a motion? We have a motion. You have a second. You're recognized. Much like the prior bill, I think we're looking at Amendment Drafting Code 017307.
That is the match, sir.
All right. We are going to, do we have a motion? You have a motion. You have a second. We're now voting to adopt Amendment Drafting Code 017307. All those in favor, please signify by saying aye. All those opposed, please say no. The ayes have it. Your bill is amended, and you're recognized for a brief description on the bill.
Yes,
Chairman
sir.
Vaughn.
It's my understanding, first off, let me get to the important parts. My understanding that TBI health and mental health departments are good with this bill. I know there's been a lot of discussion with you as well, Mr. Chairman. This has to deal with mid-level providers operating within OBOTs, but not just any OBOTs. These are accredited OBOTs. There's about 30 of them in the state. It sets an aggregate cap of 500 patients treated by NPs and under the direct supervision of one physician. There's some ratios, but note that a physician can supervise up to 5, but they still can't cross the threshold of 500 between those 5. So however, between 2 and 5 mid-level providers can go up to 50 patients under the supervision of one doctor, and that's a very abbreviated version.
Thank you. And as I've seen both Chairman Hicks and yourself, Bill, I think the magic number has been 500. So
Yes, sir.
you have heard explanation of the bill. Any questions or comments? All those in favor of sending House Bill 2093 to full health committee as amended, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you very much. And let's look, we need some expansion room.
I want to try Karen's. Okay. And I'm going to, some of us have to go to finance. So, and Leader Camper does as well. We're going to go to item number 30, which is an item that was inadvertently placed on this calendar. Item number 30 is House Bill 1333. It's actually going to be taken off notice. So that it was mistakenly calendared. So item number 30, House Bill 1333 is off notice. We will go to item number 32 on our calendar, which is by Leader Camper, House Bill 1339, that I will entertain a motion. We have a motion. You have a second. You're recognized, and we've got an amendment on there, Chair Lady. Forgive me for the speed at which we're going.
Thank you, Mr. Chairman.
We have drafted code 017098.
That's it, Mr. Chairman.
That is correct, and we filed that last week. We have a motion. We have a second. All those in favor of placing House Amendment 1, drafted code 017098 on the bill, please signify by saying aye. Aye. Any opposed, please say no. Your bill is amended and ready for explanation.
Thank you, Mr. Chairman, Committee. Chairman and Committee, this bill is simple. It was brought to me by Senator Yarborough, who has been working with DHS to craft an amendment that they felt it was something they was comfortable implementing. What it does is it authorizes the DHS to and encourages them to actively seek, apply for, and then utilize federal grants and funding for the purpose of alleviating childhood hunger. And then they would further do a report back to the health committees, both in the House and the Senate, beginning February 1st in 2025. And it'll detail all the aspects of what they applied for, what they got, and make a report back. That's all it does.
Thank you. Committee members, Chairman Leatherwood, you're recognized.
So this bill, as I read it, would require the departments to seek and apply for these federal grants, whatever federal grants may be out there.
Forgive me, you recognize Leader
Thank
Camper.
you, Mr. Chairman. It authorizes them to do it and encourages them to do it. It does not require them to do it. But if they do, we want them to give, under this legislation, a report back to both bodies of what they applied for and what they got starting in February of 2025. And whether they were denied or didn't get it.
Okay. Can't they apply now if they want to, seek them and apply for them?
You recognize Leader Camper?
Thank you, Mr. Chair. They can, but what this is a specific focus on alleviating childhood hunger. So what I'm trying to encourage them to do is, if there are grants out there specifically around getting at childhood hunger, I'm encouraging them and authorizing them to go after those dollars and then help us with the childhood hunger problem we have here. Yes, they could, but this is encouraging them to do so. Thank you for your question.
All right. Question has been called. All those in favor of sending House Bill 1339 as amended to full health committee, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill moves forward, and thank you so much for your patience, Leader Camper.
Thank you, Mr. Chairman. Thank you, committee.
Thank you. And I hope that the committee feels like we've moved through our work as appropriate. Forgive me if there were any questions that did not get asked. I apologize. We'll do better next time. Without objection, the remaining bills on our calendar will be rolled until Wednesday, tomorrow's calendar at 1 p.m. Our motion to end today's meeting will be for a recess motion, as we will start this committee and this calendar back up at 1 p.m. tomorrow, which is Wednesday, March 27th, the year 2024. We will be in hearing room 2. Without objection, we are in recess.